Hey, so I know you have quite a few presentations to do in grades, so I'm going to try my best to keep it within the 3 to 5 minute range and give you the gist of all my information I found in my article. So I looked at physical activity and addiction. The article was titled Physical Activity Habits and Their Effects on Quality of Life in Patients with Addiction, and this comes from data in the Czech Republic. This article was published in March 2023. So, looking at the historical background, research has shown that regular physical activity increases physical and mental health in patients with addiction. Addiction treatment started in the Czech Republic back in the 1950s, so it has a good history. The Czech Republic recognizes physical exercise to be accessible and cost effective, working with other treatment modalities. As you can tell, a lot of treatments do cost money. Exercise, it's based off the individual and doesn't cost someone as much money to incorporate exercise into treatment. And empirical evidence supports the beneficial effects of physical activity on abstinence rates post-discharge from the hospitals. So this shows that after they leave the hospital in their inpatient treatment, they're less likely to relapse, which probably be due to the fact that exercise is helpful. And one more thing, the psychiatric hospital in Prague offered different physical activity programs. So some of them were group exercise, uh, yoga, jogging, bodybuilding, and different relaxation techniques. And despite all the claims that regular physical activity can help those with addiction, there was a gap needed to be filled because the Czech Republic didn't have any information. So they did this research study to look at and see if it is beneficial. So the methods of the study, it was a cross-sectional design looking at investigating the association between physical activity, habits, and quality of life. There were 159 participants in the study with people who had different various mental disorders and behavioral disorders related to substance use. It was a 12-week treatment period, and data collection happened between the fourth and 12th week of hospitalization. When they gave their questionnaires, of the 165 patients surveyed, 159 fully completed them. So that's a good return rate. And the survey they handed out was called the SF36 questionnaire. It's a 36 item short form health survey that measures quality of life. So the methods continued. This is widely utilized instrument, the survey. Was organized into 8 domains: physical functioning, role limitation, physical, social functioning, role limitation, emotional, pain, mental health, vitality, and general health. Physical activity information was collected through structured questions regarding participants' activities levels before and during hospitalization. And it was defined, physical activity was defined as 30 minutes per week. So we look at this study broke into people into groups, 4 different groups. There was Group A that was broken into people who reported physical activity before and during hospitalization. Group B, it was patients who reported exercise before hospitalization, but then they decided to change and became inactive during their hospital visit. Group C were physically inactive before hospitalization, but after they were in the hospital, they decided to start physical activity. And then there's Group D, that they were inactive before and after hospitalization. So now let's look at the results. So this graph, or not graph, this collection of data shows all the different people put in the different groups, and it found that there were not too many crazy things that stood out within the people put into each groups. Like anyone in Group A didn't really differ from Group B, or didn't really differ from Group C or D. The one thing that did stand out was quality of life, and age was positively correlated with that. Hospitalized patients reported better general health, but the demographic differences were negligible against groups labeled A through D. This one's the big result, this one and the next one. So patients who were involved in regular physical activity before hospitalization displayed a notably improved physical functioning compared to inactive counterparts, which was groups C and D. We can look, this is supported by statistical significance. A majority of the previously active patients, another thing that stood out was a majority of the previously active patients refrained from regular physical activity during hospitalization. So those in Group B that participated in exercise before no longer participate later, and most of the participants shifted there. Um, this emphasizes the impact that pre-hospitalization physical activity changes once you go into the hospital. And it makes it important that we need to maintain activity levels during hospital stays because as we see, Group A who maintained it before and after were generally happier and have a higher quality of life than those that became less active. This graph is pretty concerning. So those that weren't interested in exercise before, but after hospitalization became interested in exercise after, actually reported a lower quality of life across a lot of parameters. This is actually an interesting finding, and if we look at my follow-up study later on, this is something I want to address. But Group D did not experience as many negative results or quality of did not report a lesser quality of life compared to Group C who engage in physical activity after the hospitalization, which is a weird finding to be honest. So my conclusions are the disparity of quality of life revealed the notable difference in quality of life between patients with addiction and the general Czech population. So that very first graph or collection of data I showed you was measured back to just a general population in the Czech Republic, and they found that those who were struggling with addiction are less happy and have a lesser quality of life than those who are don't struggle with addiction. Also patients who engage in regular physical activity before and during hospitalization demonstrated a significantly better quality of life compared to physically inactive patients, which does show that physical activity could help maintain a better quality of life, and it's definitely worth maintaining physical activity. What was concerning was the changes in regular physical activity habits during hospitalization. It was linked to a reduced quality of life, and that's something we need to look at. It suggests even need for tailored interventions. So if I were to create a follow-up study, it would definitely look at this Group C within this post-exercise introduction. I was wondering if this had anything to do with how exercise was introduced. Maybe Group C had never seen exercise before, and this was the first time they were doing it. While they're already undergoing a lot of stress from dealing with treatment. So in my study, I would understand the participants and evaluate their prior exercise exposure. This would definitely be in a survey and their current perceptions. And after I took that survey and found out what their prior experience was with exercise, I would definitely compare a group exercise versus solo exercise, looking to see if the social aspect of exercise is better for those that I mean, I feel like group exercise can improve quality of life. And so that would be kind of my hypothesis to look at. And then the aim of the study would also be to provide insights into exercise, social dynamics, whether like group exercise or solo exercise is better, and just seeing if group exercise can improve quality of life among addiction treatments in patients. And this would inform tailored interventions for enhanced well-being. So thank you. That was as brief as I could make it. If you have any questions, feel free to email me. And that was my presentation.